Good morning, good evening, everybody. I am Vaidya Manvikar, and I would like to talk about GCAR, and I would like to welcome you all for the GCAR webinar today. So the GCAR is Global Council of Ayurveda Research. So it is an international non-profit organization based out of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And no nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and also your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today, Vaidya Prashant Suru sir. Namaste. He is a disciple of Bruhat Trai Vaidyaraj Datar Shastri Guruji, who is a pioneer of Panchabhoutik Chikitsa stream. Vaidya Suru sir is a dean of Ayurveda at Tirak Maharashtra Vidyapit. He is a Panchabhoutik consultant and he has been practicing for more than 30 years. He has been working extensively to promote Ayurveda globally. He is a PhD guide, a known researcher, and a clinician with an academic background. Without further ado, let me pass it on to Vaidya Suru sir.
May I request for share?
Yes, please.
Is it visible?
Yes, it is visible.
Now, good morning, good evening for you, or is it good morning for you actually? Really?
Yeah,
8
here
o'clock in the morning?
most of them actually from here, from US. So it's a morning around 8 o'clock.
Okay.
9
Say
o'clock.
good morning for everybody. Namaste. My sincere prayers. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. With this introduction, let me start. I must thank the organizers for allowing me to pay homage and my sincere best wishes to all of you. Thank you, organizers. My prayers to my Guru and the topic given to me, Pittashmari, the gall or the biliary stones, for which I'm going to explain according to the Panchabhoutik Chikitsa Paddhati and the thoughts given by pioneer of Panchabhoutik Chikitsa, Vaidyaraj Datar Shastri, Bruhat Trai Ratna Award winner. Ayurveda stated Ashmari. I won't go in details for all other things. The calculus or the stone of Pitta. As you must be all aware, Pittashmaris and another one is called as Shukrashmaris are possible in our body. None other than these. Other Ashmaris are not counted. Mutrashmaris, and very rarely salivary secretions get converted into the stony hard structures or in Ashmari form. Ashmari is a hard Parthiva bolus and hard structure like a stone. When we think of Pitta, Ashmari, gallbladder, biliary stones are the name given, but in according to Ayurveda, it is related to the organ, especially with liver, Pachaka Pitta, and further, most important, Pitta Ashaya, or where the stone is situated. Pachaka Pitta, really speaking, Pachaka Pitta is supposed to be the natural way. We know all five pittas are there. There are two different types of pitta according to the Ayurveda. The first one is a Ksharadharmi pitta. Another one is Amladharmi pitta. When we start, especially with the salivary secretions for our digestion, it is basically seen that Ashmari of saliva, Ashmari of Pachaka Pitta are observed. But Amladharmi Pitta, which is Ranjaka Pitta into the body, is not observed many times. Pachaka Pitta has a tendency of Tyakta Dravatva, in which the water content or the fluidity has been lost or is reduced because of all other Mahabhutas, either Prithvi or less fluid because of Jala Mahabhut Vikruti, Up Mahabhut Vikruti, and sharp, hot Teja Mahabhuta, or the dryness of Vayu Mahabhuta. This pitta normally flows with the bile duct. We all are aware of that. CBDs, common bile duct is called as, and when that fluidity of the pitta is lost, then that pitta is converted as a stone. Sometimes in previous conditions, it might be a sludge, but then gradually it is converted to the Pittashmari. When it is called as gallbladder, liver, pancreas, they get these symptoms of Pittashmaris. Ashmari of common bile, as I have said, it might be because of Pitta, Pachaka Pitta in liver, in common bile duct, or sometimes in pancreatic secretions as well. That Pittashmaris, people with any of the following symptoms should see to their doctor immediately with the prolonged pain in abdomen, especially on your right hypochondric region or to the hepatic flexure. And if it persists with or without food, if you are fasting, and if it increases with the time, one should be well aware of nausea, vomiting, sensation of heaviness, fever sometimes because of the infection, low grade fever or with the chills, where actual indications are there. If the stone is obstructed at the neck of the gallbladder, it may convert it to Kamala, of the obstructive type of jaundice, where you can see the yellowish color on the skin, or even for that icterus and clay colored stool. We know that Ruddhapatha Kamala is the word given according to the Ayurvedic phenomena. The basic treatment suggested as a whole is normally, if you try some medicines, well and good. It doesn't help, then go. If it is non-surgical, oral medicines, and if it is not, then the surgical intervention is needed when it is an acute one or in a big in size and all other things. So according to that, now we will go with Ayurvedic phenomena. Are you all aware? Panchabhoutik Chikitsa, basically the simple samprapti for all the diseases. Yatra Sangha Kha Vaiguntha. It will come and it will go within 40 seconds now. Please excuse me for that. Yatra Sangha Kha Vaigunyat. Kha is the Akasha. We all are aware, 5 gross elements are the basics of our body as well. As in nature, is in body. And when we think the normal srotas is get obstructed with all other 4 elements, gross elements, Akasha is obstructed due to either Vayu, Teja, Jala, or Prithvi. Then the obstruction is a cause of the disease, and that phenomena depends upon according to what it is. pains and clay-colored stools might be the symptom observed. When we talk about other treatment, surgical, non-surgical, and other things, in Ayurveda, yatra sangha khavaigunnyat vyadhi tatropajayate is a basic diagnosis. And the pathology behind, when we think of Prithvi obstructs Akasha, Asti, Majja, all other Dhatu Sanchitis, and Vikruti, here that Pitta becoming Parthiva, where the Tyakta Dravatvam, the water content or the fluidity and the flow is obstructed in Akasha of that Pittashaya, then the condition arose as a Pittashmari. If Ap Mahabhuta is obstructed in Akash, we get Udara in later conditions. If Teja, vitiation of Agni Dagdha, Vidradhi, Dhatupa, sometimes it goes to cellulitis, but many a times it is well controlled before that. And here, in such conditions, we have to treat that. Vayu disturbs Akasha with Vimarga Gati, Nadi Vrana, the sinuses, and Dhatu Rasa, Kshay, fibrosis may occur, and patient may land into the any conditions. So in such conditions, we should treat in a proper way. Nidana, Darshana, Sparshana, and Prashna has to be confirmed. Darshana, patient in agony, pain in abdomen. If it is acute, if it is chronic, he gets indications of typical things with eating few heavy food. I won't go in detail. You all are aware that Pitta Prakopaka Ahara, moreover of Ksharadharmi Pitta, is the cause for Ksharadharmi Pitta Vikruti here in Pittashmaris. As I mentioned, Amladharmi Pitta may not get Ashmari because it doesn't have that Tyakta Dravatvam quality. Pittam Sasneha Tikshnoshnam, Laghu Visram, Saram, and Dravam. That Sara and Dravaguna is reduced, in which many a times Visra Gandha can be also absorbed by all of us. In Nidana, with Sparshana, the pain in abdomen, on the hepatic flexure, you can get percussions done. Patient may suggest that it is either painful or he suggests it is really pricking it. Whenever he gets that pain in abdomen, with food, without food, if he has very heavy food, especially just like cheese, paneer, khoya, and all other stuffs. See, sweet may not be the cause. Sweet may not be the cause. Then what will be the cause? Puran and solid food like pastries and all other things may convert that into the heaviness, fullness of liver. Secretions, liver being the organ of power plant of the body. Before that, we should just see, listen your patient, what are his complaints, how he is explaining, and after that you can come to the conclusion. And at the Chikitsa part, I will go in detail later, but introduction of Shamana Chikitsa is the first line of treatment, palliative line of treatment, oral medication, temporary one. Then it will get divided into two, plus cleanliness as well, and in which Dr. Vaidya Data Shastri, Vrattai Vaidya Data Shastri was having full faith with Sukshma Shodhan, because he said that many a times patient in acute condition is not Shodhanarha, fit for any type of panchakarmas, which are advised for the chronic patients to avoid following things. Rasayan Chikitsa is the last to and give a Punarbhava Chikitsa in such conditions. Sukshma Shodhan was suggested by Vaidya Data Shastri. How it was occurring? For example, I'll give you Kutaki, Katuka, Krishna, or what we call as the Picorzia kuroa is one of the Bhedana Dravya. So Bhedana Dravya with small quantity is tolerable to the patient in whatever the age conditions, because many a times if a small baby is there or the elder person is there, those who cannot tolerate the Panchakarma, we prefer to give them Sukshma Shodhana and then Rasayana or Apunarbhava. Panchabhoutik Chikitsa suggests Agni is the best of all other things. 5 Mahabhutas are there. 2, the Prithvi and Jala on the one hand, the one side which is called as Bruhana, another one especially Akash and Vayu, Apatarpana. So Agni is to balance everything, the fulcrum behind, and Agni is the best, Jatharo Bhagavan Agni, which controls, and Agni resides in our body as a Pitta. Pitta resides with Rakta, and Rakta is produced with liver. Rather, Yakrut and Pliha are Yakrut Pliha now Shonita Jau are produced due to the Rakta, but they are the basic Mula Avayav, Mula organs responsible for the production of liver, and Rakta is liver, and then life is blood, liver. So love your liver first, control your food, digestion, and all other things which are controlled by Pachaka Pitta amongst all 5 Pittas. Pachaka Pitta is the avayav or the secretion which controls all other 5 Pittas like Bhrajaka Pitta, Alochaka Pitta, Ranjaka Pitta, and Sadhaka Pitta too. So many times vitiation of Pachaka Pitta may lead to the discoloration to the skin, problems with eyes, problems with all other things, especially with the digestion. So Agni, I'll suggest you one thing. See, the liver supposed to be the Yakruta is a place of Agni. It has a place of Mahabhutagni, Teja, Prithvi, Jala, because it has a specific quality called as Tyakta Dravatvam, as I told you. So liver, Yakrut, has to be considered as a god gland of my body, of everybody's god. God, that is generator, observer, and the destroyer. It generates Pachaka Pitta, Rakta. It observes proper energy in the body. It destroys the toxins in the body. It is the reason from where the cholesterol, triglycerides, and bilirubin, and all our other controls are in liver, is the biggest endocrine as well as exocrine secretion gland, and is the highest in size. So I consider that as a god gland. You can see liver, the basic, is related to the heart, skin, eyes, kidneys, brain, for Sadhaka Pitta and all, as well as for Yakrut Pliha. Both. One is the controller, one is the producer, and the third is the which excretes out all the toxins into the body. So that is how liver is most important, Ayurvedic perception of liver. So I request my patients to love your liver. Don't keep it as dry. Don't keep it as in hunger, and don't ask liver to be sluggish in your body. Energy and utsaha, the Vayu Karya, is said to be utsaha shwasa nishwasa cheshta vega pravartanai. The first one suggested by ancient Bhratrais, utsaha depends upon your liver. So when you get Kamala or such disorders with the liver disorders may lead to the sleepy and tiredness, and especially last thing we say as a syncope, moha, sannyas. Which sangal herbs we can use? Many to stimulate, to get rid of Prithvi Mahabhuta's Ghanata, Guruta, Sthirata, and Sthulata. Sometimes Anulomana is required, and many a times Bhedana is required. Haritaki, Amalaki, Guduchi, Katuka, special for Bhedana, and Neem, Karait, Kirait, Chirata, Vasa, Kalameg, Bhumyamalaki, Kumari, Sharapunkha, Rohitaka. These are a few herbs which are in my practice. I do use them. Arog and Shuvadavashtradi Gugul is my practice to use for Ashmari, Shula. If Shul persists, then Vata Vidvamsa, Mahavata Vidvamsa, in sometimes Amalaki Kshar. See the difference between here the Pitta vitiated is Ksharadharmi Pitta, and to get rid of that, to increase water content and Jala Mahabhuta, we prefer to have many a times something Amla Dharmi Dravyas. Amla and Kshara Siddhanta is applied over here as well. I have not yet mentioned here, but Patolam Sariva Musta Patha Katuka Rohini, that Rakta Pachaka part is also very useful in such conditions, which takes care, especially with Sariva, which is Sara in Gun, digestive, Doksharadharmi, Shita Viryatmak, Pachana Dravya, with Prasadana of blood, which enhances the complexion and luster of our body as well. So along with Arogya Vardhini, Falatrikadi Gukul, Shvadavashtradi Gukul, I do use Patoladi Gukul many a times. The patients who are at acute conditions of pain in abdomen, then Amla Dharmi, one thing is obvious, Amalaki Kshara can be used. See, the Amalaki is drug of Amla Dharmi, but the Kshara Kalpana is used to give the proper strength, because Kshara has tendency as a hygroscopic nature, and that increases the water content within. And with that water content, the chances to break down those stones, break down that Ashmaris into the pieces from your Pittashaya or gallbladder is easier. So Bhumyamalaki and Amalaki, Kalameg, Sharapunkha, Rohitaka, along with these Falatrikadi, Gokshuradi, Patoladi, Arogyavardhini, Chandra Prabhavati can be used with profit. For Pittashmari, Gorochan is supposed to be the best medicine. Samanena Samanasya Vruddhi. Vruddhi, Abhishyanda, Paka, Vayu Nigraha, and the last is Sroto Mukha Vishodan. These are the five ways we describe to bring doshas from Shakha to Koshtha. To bring proper Pitta back to the Shakha to Koshtha, many a times Vruddhi is useful. So Pachaka Pitta, the Gorochan of cow's bile, is used to break Ashmari. But many a times it is not that easy to grate it. It is not easy to maintain because it gets spoiled very early. Then we suggest coriander and cumin seeds, dhania jeera pani, along with kulatha. Kulatha, the horse gram, is used especially for Ashmari Bhedana. Though it is Ksharadharmi Pitta, with the decoction or the soup, what we normally call as a Mugacha Kadhan, like that, we can prepare Kulatha Yusha along with, which includes that Bhedana Karya, enhance the fluidity, and the results of Ayurvedic preparations are better along with this Anupana, Dhania, Jeera, and Kulatha Yusha. One portion, one spoon, you can say, of Kulatha, one portion of Jeeraka, which is Dhatvagni Deepana as well. Jeere are called as Jeeraka, is Deepana, and Ksharadharmi Dhanyaka is especially for Mutrala and taking out doshas out from body with Abhishyanda. So Vruddhi, Abhishyanda, Paka is controlled. Many a times acute conditions when patient is complaining, burbs, burning in chest with the acid increase, we ask them to have either Shankhavati, Lashunadivati or Amapachakavati to suck, to chew, and along with that, that secretion or saliva is especially of Pitta Pradhana, Ksharadharmi Pitta, which is having tendency of basic nature, followed by gastric secretions of stomach, and then this Ksharadharmi Pitta, which starts from liver, and common bile duct takes pancreatic secretion as well. Some asavarishtas are asked for, Kumari asav. I do ask patients to take Trifala Kadha, Falatrikadi Kvatha, Falatrika Amruta Tikta Nimba Kairata Vasakaihi. This formula is not Trifala Kadha. It is Falatrikadi Kadha, which is good for from their own channel. Rohitakarishta and many times Kumari Asav are useful for conditions of spleen as well to enhance that. Rohitakarishta, Dhatri also used in Arishta Kalpana, Dhatre Arishta, Lohasav to improve the hemoglobin percentage. The specific drug I mentioned, Gorochan, but Yakrut Plihari Ras, Ashwakanchuki and Naracharas for Shodhana, especially they are purgative, they are Bhedana, they are taking doshas out. So Shodhana is done with Ashwakanchuki, Naracharas. Only Anuloman will not be helpful sometimes. Haritaki may not be substantial. Then you need Bhedana Dravya. Srausana Dravyas like Aragvat Kapila or Vidanga Kapila are also used in children patients, where Ashwakanchuki and Naracharas like such strong medicines are to be avoided. And in those conditions, we prefer to have Vidanga Kapila or Aragvat Kapila with the Sransana quality, because Srausana and difference between Anulomana is in Anulomana, it takes only Pakwa Mala out of your body, but Srausana Dravyas take Pakwa and Apakwa, both the Malas out. So in such conditions, Srausana is more helpful many times. With Naracharas and all, Panchabhoutik Chikitsa suggests a Punarbhava, and those patients with less immunity, we prefer to have Mandura Bhasma, Tamra Bhasma. Tamra is for Lekhana, Mandura, Raupya, Suvarna are given immunity built up and liver stimulant for body, and others like Shilajit, Suvarna Makshik Bhasma are in our practice to enhance. The dose of bhasmas should be very less. Anupan, it may be with ghee to enhance your, kindle your Agni and to enhance your digestion, to give strength to your liver, and the dryness which is supposed to be caused due to the heat. Here, that water content is more important. Jala, Prithvi. Prithvi has to break in with water and followed by Teja. In such conditions, Tejas Dravyas like Shunthi or Chitraka can be used with profit with controlled manner dose, because patient may complain about the heat and may get Arshoti Sara Grahani Vikara. With your medicine, it should not increase. So be aware of that and use these medicines for your practice. Many a times, we know nature tries to balance between. So to control that, we should control ourselves. We should care the nature of the natural things, nature of our gut, nature of our digestion. How we can improve it? We should improve it with the proper timings, proper intake of water. Do not exaggerate of anything. Fasting, intermittent fasting for long may cause another cause for Pittashmaris. Pitta can get vitiated. Very heavy food, very fatty food, fatty livers may cause like this. With constant improper timings of diet, improper sleep habits, and the lifestyle of today, what we are observing, have that tendency to increase fatty liver changes as well as the vitiation of liver, and further with the Pittashmaris. Drinking aerated cold drinks without use of water, improper quantity of water may be the cause of Pittashmaris. So Pittashmari, though may not fatal, may lead to the liver disorders further or serious disorders in nature with chronic conditions of Pittashmaris. I have seen some patients with their chronic weakness of liver and gallbladder. If it is removed according to the modern medicine, it may get turned into some other disease in nature and naturally later conditions into the cancerous growth or something. So avoid this. hemangiomas and all other things, liver abscess are different entities in which we need a little careful observation and treatment according to the patient's way. It needs a typical tailor-made treatment for those patients. But in all and in a natural way to treat Pittashmaris, we have Panchabhoutik concepts behind us. So care your nature. Nature will take care of yours. I'm sure with small presentation, and I'm really apologize for my technical difficulty. Please accept my sincere apologies. And I must thank the organizers to giving me this opportunity to present something which I have. May I stop that sharing my slides, please?
Yes, sir. Thank you so much. It was very insightful. Amazing presentation, and thank you so much for sharing, like different herbs as well as foods which are helpful, and a very different way of looking at the Pittashmari from Panchabhoutik Chikitsa, because not many people are aware of it, or they don't know what is Amla Chikitsa, what is Kshara Chikitsa. So this was very, very insightful. I would like to open up now for the participants. If anybody has any questions for Suru sir. Yeah, and I had one of the questions that was regarding intermittent fasting, and you already answered that. I have, one of the clients who used to do a lot of intermittent fasting in order to reduce weight as well as sugar, and she ended up actually having Pittashmari. So,
Because of drying up nature of water content, which is required whenever you are cooking something.
mm,
Many a times that proper water content, if it is not there, either you get burned something, or you get very really not tasty food or half cooked. So we need purna pakwa anna, and then converted into the energy to utilize our energy for long. So intermittent fasting should be careful. Do not run for any of specific diet, only fruits, only something. So quantity taken, excessive acidic nature may need excessive pitta to be produced for digestion. Especially that excess amount of water is also not nature. Bahu pittam, जैसे हम कहते हैं, or what we say normally, that excess amount of water intake. Atyambupan is a cause of acidic nature of pitta. And if acidic pitta is increased, the indication sent to the liver and pancreas to send excess amount of ksharadharmi pitta. And that need is supplied by liver as well as pancreatic secretions. Pancreatic secretion is to balance in between amla and kshara. So it is called as swadu rasa. It is not madhura rasa. Swadu to balance. So swadu and madhura are little different meanings, and a small line in between, which is moreover, if you eat a lot of chilies, you need some acids to control. And if you have excess amount of alkali acidic food, then you need alkaline nature from the pancreatic secretion. So to balance in between, if you don't have that regular practice to have proper amount of food which you are taking, many times I have seen my patients, they are suggested by doctors to change your oils. Do not continue the same oil.
mm,
Sometimes you take groundnut oil, sometimes you take some other oil for sunflower, or you take olive oil or something which is not suitable actually for our body. Our body has some memory, the which type of oil is going to come. And if by chance you have some change in that conditions, body gets disturbed by changing rice bran oil once, then another time you are cooking in coconut oil, next time you are cooking with the sesame oil. So that nature disturbs your digestive tract, villi, and secretions from liver. So liver get confused. don't confuse your liver. Give exact amount of food, give exact timings to that secretions. Because if you change your food timings, diet timings, then liver get confused. When should I send this my production? And at that certain stage, if it is not there, your digestion will get problem. And to avoid that, I will suggest changing oils are not ideal according to Ayurveda.
Very, very nice. It's a great.
And the oil has to be decided according to the area where do you stay and which type of food you take. For example, in Seattle, it has excessive amount of cold and watery punch up like that climate. And in Houston, it is totally different. So using same oil at different places is not ideal. In Maharashtra, the groundnut oil is used. And in Punjab and in the area in between Ganga and Yamuna, they prefer to have mustard oil. Sometimes it is cooked. So all that depends upon the kshara and amla, which is balancing your body. So to balance your body, one has to take the diet, one has to take the exercise according to their need. Pittashmari sometimes may not allow you to have excessive vyayam for their body. Do not exercise more. Exertion and exercise are different. Exertion may hurt you. Exercise may make your body healthy. So be careful. Help your body to be in soothe, swastha.
Right,
Namaste,
right.
sir.
That's a great recommendation.
Sir, your audio is not working.
Okay, okay.
Yes,
sorry to join late
no.
because
No problem. Very nice to have you.
Your presence
Yes,
made me very happy. As
okay,
for Apte madam and all other participants as well.
yes, yes, yes.
So I had another question. I was wondering about copper water. So
Yeah.
here actually, in the West, many people they prefer to drink copper water now as they are trying to learn about, dinacharya, what things to add to every day. So do you have any thoughts whether it is useful or people should do it or not should do it? I mean, it depends on everybody's prakriti, season, all that, but still, as a general recommendation.
The copper has tendency for lekhana,
Mhm.
where excess increase. Because in modern way, which I have not mentioned about, there are two types of pittashmaris they describe. One is moreover of the cholesterol and another one is of the bilirubin.
Mhm.
There is a little different.
Right.
Cholesterol, a good cholesterol is required to the body, and excess amount of cholesterol is a side effect of something else, secretions and all other, where liver becomes sluggish, in which parthivatva is more. And to break that, copper helps a lot. So it has that lekhana quality. Shulba is used in Arogyavardhini as well and in my practice as well, which I mentioned. Suvarna Makshika, which contains CuFeS2. It has copper as well as iron too, because in later conditions, because of improper digestion, patient may lead to Pandu. Pandu rogi todoptyartham, pittalani nishevate. He gets converted into the Kamala. So to Pandu patients, the anemic conditions, to enhance that, it is to be careful of use of Shulba in such conditions. Dhatuvagni Deepana is important. Sometimes Laghu Malini Vasanta, followed by Madhu Malini Vasanta, and for Apunarbhava, Suvarna Malini Vasanta may help in later conditions gradually, in chronic conditions. But in acute, sometimes Shulba, Tamra Bhasma is used. So copper bottle, if it is clean in a proper way and properly maintained, one can use a water which is boiled with gold preparation or gold coin. Suvarna Siddha Jala will be more useful, especially in such conditions you can preserve it for not more than 3 hours. One should not keep it in a copper vessel for long. So it will be useful and in a proper proportion. If you go on drinking 3 liters of water with copper only, then it may hurt you to your liver as well.
Right, right, right. Absolutely. Yeah, that balance has to be maintained.
Yes. Anything, ati sarvatra varjayet. So do not go on the both the ends. So balancing in between is the role of Kaya Chikitsaka. Kaya Nama Agnehe. So we balance Agni in our body. And that is more important. We are called as Kaya Chikitsaka, those who balance Agni in the body.
Right, right, right. Absolutely. Very, very true.
Yes.
Yeah. So just last thing about, again, intermittent fasting, if anybody wants to do, what care that person needs to take, or any recommendation for that, because I see this is everywhere, everybody wants to do it nowadays. So is there
As a
any?
custom and traditional way, and rather way of life, of science of life, Ayurveda suggests fasting. It helps up to certain extent to get rid of samata, am, and all other things. It is required with different types, vyayama, atapa seva, maruta seva, or also called as something related to the fasting. Upavasa is
Shaman.
not upavasa, that needs sometimes warm water is also upavasa. Many a times light diet will help, especially. So keeping fast without nirjala ekadashi or nirjala something is not ideal for anybody. Rather, to maintain normal health, to control yourself of your mind, if you control, I'm observing that my friend is eating something with lots of cheese and paneer and all other things and sweets and cakes and pastries and all, and I'm interested to have them. If I cannot control my belly and my tongue, rather than my belly, if you control your test of tongue buds or the taste buds, then you win everything. That control of mind is most important than any type of fasting. Fasting is ideal for maintaining our bowel movements clear. Yatra Sangha Kha Vaigunya, there should not be samata obstructing your channel, Mahasrotas, and all other srotasas like Purishava srotas converted into chronic constipation in later conditions. In such conditions, sometimes that oiliness of Chinsa Lavana Taila, Basti, may be useful. Panchakarma also helps in chronic conditions, but in acute condition, it is never suggested.
Right, right, right. Thank you so much. Thank you so much. This was very helpful and very insightful.
Thank you very much. It was my pleasure to.
Just want to check. Anybody has any questions for Suru sir regarding Panchabhoutik Chikitsa and how to work with, or how to take care, manage the Pittashmari? Okay. I don't see anything. All right. So just give me a second. All right. So thank you again, everyone, for attending this, today's webinar. This was absolutely amazing, very helpful for everybody. Namaste. And
Namaste.
this recording will be uploaded to the YouTube channel. So please watch and subscribe to our YouTube channel to view earlier as well as this webinar and all the presentations. Please like, comment, and share all the videos. And once again, I invite you to become a member and also fill out our volunteer form. So you can now also subscribe to the You Update, that is the newsletter by GCAR. So you can also, get to know what activities and projects we are doing. If you have any questions, please feel free to contact us at ayurvedaresearchusa@gmail.com, or you can also email me at savary@mnayurveda.com. Yeah, namaste, sir. Patankar, sir, you. You want to speak?
Yes, yes. As usual, very well explained by Prashant, because he is a good orator, good practitioner, and not only 100, but 1000% better, I should say. And so, sorry to say better, but best. So his explanation is very excellent. Means it will help to common man and our Vaidyas also, because so many Vaidyas make mistake by advising copper vessel water. That is not also correct. As he explained about the Vyayama, that is Ardha Shakti as per Ayurveda. Because nowadays it's a, I should say, fad for exercise. And two wrong things they are there. One is the gyms are AC, they are having water in between. So very well explained. Okay.
Thank you very much. I'm highly obliged with all of you and allowing me to spread something with Panchabhoutik Chikitsa, and my sincere prayers to Vaidya Data Shastri, my Guru, Vaidya Kolatkar sir, and all my seniors, Dr. Apte madam, and everybody. My sincere prayers. Thank you very much.
Thank you so much.